This episode of Beauty and the Surgeon podcast is brought to you by Let's Get Checked. Let's Get Checked is an online company dedicated to making professional health testing easy and accessible. Let's Get Checked offers fast, affordable, completely confidential at-home health tests from a range of tests from STDs, male and female hormones, and even COVID-19. Listeners of our podcast who are new to Let's Get Checked get 20% off by using our URL, trylgc.com/beauty, and be sure to use the code BEAUTY20 at checkout. That's trylgc.com, trylgc.com/beauty, BEAUTY, and be sure to use the code BEAUTY20, BEAUTY20 at checkout. Do it. Getting tested is important. It's the responsible thing to do, and you know how important I think it is to make sure you understand your labs. Welcome, everyone, to Beauty and the Surgeon podcast. I'm Amy. I'm a nutritional therapy practitioner, and I'm joined today, as always, by Dr. Jason Martin. He's a board-certified plastic and reconstructive surgeon. Dr. Martin, how you doing?
I'm doing pretty good, Amy. How are you doing today?
I'm good. Before we start this episode, a reminder to everyone that if you're listening to this episode and you'd like to watch the episode, you can find that on our YouTube channel, which is at Jason Martin MD. You can also find us on all social media at Beauty and the Surgeon podcast. So you know my favorite thing on YouTube has become recently?
What?
It is to listen to videos in 1.5 speed.
So you do that for just to be more efficient, or?
It's to be more efficient. And I guess I also listen to a couple of YouTube people that talk really annoyingly slow.
Yeah.
So it makes them tolerable to listen to.
Right, totally.
But even when I listen to our podcast, I listen to it on 1.5, and I do that because it makes me disassociate from the fact that I'm listening to us talking.
Right.
Because we sound a little bit different. So if you're looking to shrink the length of our podcast, which are not very, very long, but listen to us on 1.5 and you get it done in.
But then we're going to troll you because we're going to speak really fast, and that's going to be really fast, like chipmunk fast. All right.
Yeah. So today we have a great topic, and it's one that was actually a recommendation from a listener, and it was asking about, should you travel for surgery, or can you talk about traveling for surgery?
That's such a good topic. Mm-hmm. How have we not done this topic?
I was surprised too, because it's something that not only is a great topic, but a lot of our patients travel for surgery.
At least probably half of our surgeries, close to half, are from somewhere besides our general area.
Yeah, and even if that's just in our state, people
they're traveling
and
staying in hotels and
or the border states. We get a lot of patients who come from the states that surround our state because there's not a lot of great medical care in those areas.
Dude, throwing shade. That's okay.
No, it's just saying the truth.
Throughout Wyoming, Kansas, New Mexico,
the very rural areas of those places.
Utah.
Yes. Hey, I'm throwing out our state as well, because the people who travel for surgery within our state are traveling for those reasons as well.
I mean, we're in a big city. Denver is one of the larger cities in the United States, so it makes sense that they would go to a metropolitan area. So I got it.
So let's talk about why travel for surgery, the reasons why people travel for surgery. This is so good.
So I want to say, when I was in training, this doctor would always talk about, he always had this funny story. He thought it was funny. You're not going to think it's funny. And the patients would say, well, I'm thinking about going to, Costa Rica for my facelift. And he says, he goes, this is what you say to him. You look him in the eyes. You say, oh, Costa Rica's a good place, beautiful. I had a patient go down there for surgery about 2 years ago. I'm not sure what happened to her.
Never saw her again.
Again. Amy and I are very travel supportive, just so you know. But there is a lot of things you need to work through before you actually pick up and go somewhere.
Well, we'll talk about those things.
Yeah.
What I'm talking about now is just why do you think someone would even consider traveling for surgery?
Okay, well, you tell me.
Yeah, there's a few reasons that I think are very valid reasons. Cost being at the very bottom of my list, but that is a reason why a lot of people travel for surgery, to find it less expensive. Mm-hmm. Surgical expertise or specialty. Main reason people travel for surgery is to find an expert in that specific surgery or that specific field.
We get that all the time.
Yeah. Think about the Mayo Clinic. People travel there from all over the world for that reason. They're experts in that field. You have help with recovery. Maybe you are a single person and you want to travel closer to your sibling or your parents or whatever, your friend who could help you recover. And confidentiality. And that's a big one with a lot of our patients travel for surgery for that reason.
Huge. Yeah. Because they come from small towns and they're like, I do not want to do surgery in the town that I'm in. I don't want people to know what I'm doing.
Right. And it's not, no shade to these rural town hospitals, but you do just kind of know everyone. So everyone knows everyone and they know you.
Yeah. Like the nurse that's wheeling you back to the OR for your breast augmentation is like your neighbor or something.
Your neighbor, her husband is your vet. Your kids go to school together.
It's basically a nightmare.
Yep. You literally know everyone. So those to me are very valid reasons why a person might decide to travel for surgery.
Yeah, I think so. There's probably more reasons than that. I think those are the top ones. I think the big one is his expertise. Now with the internet, and obviously this show is very popular now, so this represents what the internet can do. people get exposed to more and more information and to more and more people. And some of those are professionals like me. I mean, we get people reaching out all the time for some of the technology procedures we do from all over the country. And it's really interesting to find out where they found you from. We talked about this before, but we had a consult from Norway. You know, people, the world's small now with the internet, and you can find a lot of people, but you have to do your due diligence. That's really important. But I think expertise is the big reason.
Yep, and that's why it's the very top of my list. Yeah. So let's talk about some of the pros and cons of traveling for surgery, because obviously, as you mentioned, the woman who went to Costa Rica and never came back. There are definitely
I'm not
pros
really
and
sure that
cons.
woman existed. I swear.
This fictitious woman.
Yeah.
But
and he said you got to look away. You got to say, she went to Costa Rica and she never came back. And you look away.
like, I'm glad that you got such thorough medical training.
Yeah. This guy was a hoot, man. That guy was funny. He had a lot of those things where he would keep it in his pocket and pull it out, you know, when people came out with crazy ideas.
He had his little Rolodex of things you say to people. I think that's awesome. So let's talk about the pros first, because we like being positive. So pros, like we said, expertise. You can choose the best surgeon.
Right. Just because you're in whatever town or city, even a big city, doesn't mean you have the best expert at whatever you want to do there. That's for sure.
Yeah, and that goes for cosmetic surgery, but also for all surgeries.
Everything.
Yeah, if you have a very strange type of, I think the stigma of traveling for surgery, you can take a lot of it away if you think of it in the way that, what if you had a very specific type of like brain tumor? Yeah, you might have a great neurologist in your town, but there's a person, you know, across the country who specializes in this specific one. Yeah, pretty sure you would go to that guy.
Totally.
If at all feasible. Like, you know, choosing the best surgeon is, I would say, the best pro of traveling for surgery. You take the locality out of it and you pick the best guy.
Yeah, and I think the hard part with cosmetic surgery is that it's so marketing driven that it's hard to understand what's true or not. Yeah. And whereas like if you had some really rare brain tumor, there are people that specialize in those and like they do research in it and that kind of stuff. So
it's gonna be easier to find the expert, is what you're saying.
And it, especially with cosmetic surgery, some of the cosmetic surgeries we do are basically a commodity. Breast augmentation is like uniform. I mean, you can go anywhere and get a breast augmentation. And, you know, I think maybe those lose their value of travel. But if you do something with a breast augmentation or something a little more complicated that involves either a newer procedure, new technologies, or something, you know, some practice that ultra specializes in this procedure like breast augmentation, you may want to travel there.
Yeah. So another pro is low stress recovery without the demands of home.
Oh, that's a great
reason to travel.
And plus, you're in Colorado looking at the mountains. Yeah. I mean,
put
on some John Denver.
Yeah.
Go recover out in the woods.
Even if you don't come here to recover, I just mean traveling in general. You know, you're not home. You're not having to do the dishes and the laundry. And
but that would stink if you lived in like Santa Barbara and you had to go to like Detroit for your surgery.
Yeah. But that's what I mean. It's still the demands of home. I said low stress. I didn't say beautiful. Okay. I did not say picturesque. I said low stress.
Gotcha.
Without the demands of home. And yeah, that really is a big one, especially for, you know, men and women who work or have very heavy demands at home. It's really hard to be back home, even if you are recovering from surgery and not, you know, do stuff.
Especially with the children's.
Right. Yeah. Or your own house. I mean, like, do you not do the laundry? Like, really? You gotta sit there and let somebody else do the laundry for you? Like, most people can't just sit there and do nothing.
Right. So, or you can't. That's reading between the lines.
Exactly. I can't. So most people,
my wife can.
Me, I cannot. So, you know, that takes that out of it, which does make your initial recovery probably a little easier, you know, a little bit less stressful. And confidentiality, like we talked about before, is a big one.
That's a huge one for our practice. I mean, I get that's a big one for our practice. This is because we get people from small towns that just want to get away from the town they're in.
Yeah. So let's talk about some cons, because obviously,
big time.
Woman who went to Costa Rica, there are some cons to traveling for surgery. I would say the number one con that comes to my mind is postoperative complications.
Yeah. I mean, what do you do?
Exactly. What do you do? Like, do you have a plan for that?
Right.
You know, what do you do if you have a postoperative complication and now you're very far away from your doctor?
Right.
You're maybe going back to an area where there's not amazing medical care.
Right. And then you go to the local plastic surgeon and he's like, please get out of my office.
If there is one.
Yeah. Get out of my office.
Right. Or you go to just the ER. Like, what do you do if you live in a town that has one urgent care maybe?
Right.
That has a traveling doctor.
And you did some strange technology treatment.
Right. They have no idea. So now you're going to be transported to another hospital.
Or something like that.
Right. It could be. And that leads right into my next one, which is extra expenses. Even things you may not think about, like what happens if you have a complication, hiring a private nurse to be with you if you don't have someone to take care of you at your location, hotels, you know, all that stuff is extra expenses. So even though the surgery itself may look cheap on paper, have you really calculated the full cost of that surgery, including all of those extra
And we have
expenses?
that discussion in reverse. There's some people we see here they're like, I'm thinking about going to so-and-so or down there. And we're very supportive of that because that's like half of our practice. So we're like, yeah, go wherever you need to go. But then we also have a conversation with, just remember, you really need to do that calculation, do the finances on that trip, because the plane flight, the hotel, the food, the transportation, and then the extras. That nursing care is a big one. So,
well, just all the unexpected expenses that happen when you travel. I think everybody who's traveled understands that it never really costs what you think it's going to cost.
Yeah.
So, language barrier if you're traveling out of the country.
Yeah. So out of the country gets into a whole bag of worms. Is that still a saying anymore?
Yes, I think it is.
Okay, good.
Worms still exist.
Okay. I don't know. What is bag of worms? What does they mean? Because they're slippery?
I think it's just because if you open it, they all just go all directions. They're hard to contain.
What are you opening the bag upside down?
Yeah, you dump it.
Okay.
And the worms just go everywhere.
This is definitely something from the 20s or 30s. Anyways, if you go to a different country, this can be horrific. Right. So I'm very supportive of international surgeons. They're a big part of my professional society.
Well, they do a lot of the research that allows
we can't do
devices
because the FDA won't let us do anything. I personally know international surgeons that I really respect. I've even sent patients to international surgeons. So this is nothing against them. And there's some really, really good surgeons in certain countries. There's certain countries that do probably more plastic surgery than we do. Brazil, Korea. So that's okay. And even in a lot of those countries, they have nationalized healthcare. Forgetting about the political discussion of that, nationalized healthcare is actually kind of good if you're in a foreign country and the proverbial shit hits the fan. At the very least, you can go somewhere you're not going to get, strung out to dry financially. But then you're in a foreign country.
As far as I know, and I would, if you are not a national person of that country, their healthcare will not cover your expenses.
I think it's that you have to pay, but it's reduced. Whatever the case is, it's not like America where you go in and they just give you a bill for $100,000 and say sorry.
But I wouldn't expect that your complications would be covered either.
No, I think
in a foreign country.
That's a good point. I guess it depends on the country and the healthcare system. Whatever the case is,
you should probably find out that before you travel.
Exactly. This is getting down the rabbit hole of what we're talking about. You could just go way down that. And the real problem is, if you have a real problem, is how you're getting home. And getting insurance for medical evacuation is very expensive. It's not cheap. And when you calculate all that and the risk assessment to go somewhere else out of the country, for me personally, who's someone who's supportive of surgeons outside the country, I don't see the value there. I think the risk is too much. Even though you're probably going to have a good surgery, you will definitely save money probably on the OR fees. But this is the overall cost of travel, the stay, and et cetera, I don't get it. Now, exactly like you said, if you have family down in Costa Rica or if you have family in Brazil or friends, that's totally different. Yeah. That's like you coming here and you have family or friends here.
Yep. Yeah, we have patients who have family, and one who has family in Colombia and has had surgery there, and it's great. And
yeah, she loved it.
Yeah.
And she actually know the person she wanted to go to.
Yeah.
He's a nice guy. I like him.
Yeah.
So I think that if you're just talking about picking a country because you heard it's cheap and they have good surgeons, I would highly do the research and then go from there.
Yeah. And I think the language barrier, I say that because, you're probably not a medical professional, the person having surgery. And if you were to have a complication and you do end up having to be in a main hospital, your own chosen surgeon and his staff may speak the language you speak, but the rest of the hospital staff probably will not or have limited ability to communicate with you. So if they're trying to communicate to you very complicated medical issues and you do not understand them.
People don't normally understand it when I'm speaking English.
In English. Yeah, that's my point.
I think if you add a different language on, you might as well stop.
Yeah, it's going to get very complicated very quickly. Yeah. So that's something to think about. If you're not fluent in the language of the country you're going to, that could be an issue. Follow-up and continuation of care.
There's one more thing on that. So if you look at the assessment, this is say it's $2,000 cheaper. It's $2,000 worth the risk overall. Because if something does go wrong, then you're going to be paying $10,000, $20,000, $30,000, $40,000 ultimately, right?
Potentially.
If you were in the United States, it depends, but most likely you wouldn't be stuck in that scenario. So,
yeah. And to be fair, postoperative complications, I'm not saying that is anything that's unusual, right? That happens. That happens to all surgeons at some point have a postoperative complication.
Not me, Amy. I don't know.
Right? Sometimes they're nothing. Like sometimes they're extremely minor. A postoperative complication might be that you had a reaction to the tape that was used. You have blisters everywhere.
Right. If you get down to that level, pretty much Like, almost everybody has something.
Exactly. That's what I mean. So, and if you have a major postoperative complication, which we have had, not from us, but we had a patient who had a complication from a surgery she had at the same time as our surgery.
Yeah, I remember that. Yeah.
Had an issue of a bleed. Wasn't our surgery, but we were glad she was in the hospital.
Yeah, but technically we were doing surgery at the same time, so it's our responsibility.
Yeah, and you were the first one there. So that's what I mean. So the cost and the issue, that's not the postoperative complication itself is not the concern. It's how it's dealt with when you're not home.
Yeah. And then the waterfall effect from there.
Correct. And then that leads right into follow-up and continuation of care. What happens if you have a postoperative complication once you get home?
Right.
Then what happens?
Then you go to your local plastic surgeon and he's going to be staring at you like you went to where?
Yeah.
Yeah. Okay.
Like you want,
and I'm going to take care of it.
And now you want me to take care of you? Yeah. That's going to be hard to find.
Which, by the way, we do that a lot in our practice because we have so many patients coming and going, but most practices are not going to be cool with that.
No, they won't even see you.
Yeah, they won't even see you.
And there are cases that we won't see either. I mean, there are definitely times when sorry, you need to go back to your operating surgeon if they're within a reasonable distance of where you are. So let's take a short break before we get into the rest of rest of our podcast. We'll be right back.
Bye.
Dr. Martin, I'm super excited to talk about our sponsor for this podcast, Let's Get Checked. If you've been a listener of our podcast, you know that we have never had a sponsor before, and that's because we're an educational podcast. We're not looking to monetize, and we also would never recommend something that we didn't believe in and or use ourselves.
So basically you're saying we're very choosy.
We're very choosy when we come to our testing, but Let's Get Checked really aligns with our values. We talk a lot about monitoring your blood values of certain things. We talked recently about vitamin D serum levels. We talk a lot about hormone levels, and it's hard for some people to get to a lab, or you're afraid of the blood draw, or just, you're concerned about confidentiality. Like you have a lot of concerns and you just don't do it. Let's Get Checked makes it super easy because it's completely confidential. You do it from your home. So there's really no excuse not to do it.
Yeah, and we did it recently. Both Amy and I did it. She looked at her women's health, basically her hormone levels, and I looked at mine on the men's health side with testosterone. It was very simple. You go online. Their online interface is really easy to use and good. We got the testing kit very quickly. And the test itself, actually doing the stick, you do a stick on the end of your finger, is not hard to do. It only took about 3 to 4 minutes. You put it back in a sealed envelope that's confidential, goes back to them. You get your results in 2 to 5 days. It's really that simple. And the best part is it's about empowerment, about you taking control and trying to do things that are positive for your health and life. And this is one way to do it literally from the comfort of your own home.
Yeah, so they offer a wide range of tests. So they do men's and women's hormone panels. They do a full panel of STD testing. They also are now offering a COVID-19 test at home. So there are a lot of other just basic blood levels that you can get tested as well. And one of the things that we always say is you can't track what you don't check. So you might not know what's normal for you in the future if you're not checking it now, especially as it relates to hormones. And men's health specifically, I feel like is a little bit undertreated. I mean, sperm counts are dropping by a large percentage in men these days. Most men struggle at some point in their lifetime with low testosterone.
And those men do not know what the symptoms of low testosterone are. Depression, anxiety, sleep problems, osteopenia or loss of bone, loss of muscle, and something we treat all the time, gynecomastia or male breast growth. These are real problems that can be improved or treated with testosterone. And these men do not know their levels. It's so easy to get checked. And this is why we're so excited about the sponsor.
Yeah. And Let's Get Checked is a completely CLIA certified lab, the CLIA lab. So they're a well-established, completely safe lab to use. You do get contacted after, so you get your results. I got a text at 4:30 in the morning, which I loved, that my results were ready.
And we're both up at 4:30, so that was good.
Super excited. And you have access to not only a nurse, but also a physician. So a physician does review your results, and it gives you a little breakdown of like where you're sitting on those levels. Dr. Martin's had even comparisons of like where 2 of the levels should be in relation to each other, which is a really important thing to note.
Right.
Just being within the normal range is not always enough. So it really gave more information than that. You'd still want to, of course, reach out to your own doctor if you needed some additional assistance with these labs or you did see something that was concerning. We didn't, thankfully, so that was good.
Yeah. We were both good. This podcast is about empowerment. It's educational. In my private practice, I'm a board-certified plastic surgeon. We are all about empowerment, and this is one way to do it. So we're very excited about the sponsorship, and we're looking forward to using it for our patients moving forward.
Yeah, so as a listener of our podcast, if you're also a new time user to Let's Get Checked, which a lot of you probably are, we do have a 20% discount code. So you do need to go to our specific URL, and it is linked in the description box below, but it's going to be TRYLGC, so LGC, like let's get checked.com/beauty, BEAUTY. And you'll need to use the code BEAUTY20 at checkout. Beauty again is BEAUTY 220. And you can pick a test, like any test you'd like, put in our code and get your test shipped to you. Getting tested is the right thing to do. It's lets you know where you're at and what's responsible.
All right. Well, let's get tested.
Let's get tested. Let's get checked.
Let's get checked.
Okay, so we're back. We talked about the pros and cons. Let's talk about what you should do to actually get ready to travel for surgery.
Okay, this is all you. I have nothing to add to this. They just show up and I do surgery,
I'm
basically.
sure you have a lot. So there are a lot of things. I mean, we talked about the pros and cons, which may have brought up a lot of things you haven't thought about. But what are some really important things you need to think about before you go? And this is why I titled this slide, Before You Go.
So number one, you got to pack your bag.
Yep.
You got to make sure someone's taking care of the dog.
Yep.
You got to tell people you're going somewhere.
Maybe.
Or maybe
Confidentiality.
not. Or maybe not. Maybe not. I don't know. You got to take off work. What do we got to do here?
So the main things I would want to know if I was traveling for surgery is how long you need to stay in your location after surgery.
Yeah, of course.
And that's a big, we talk to patients about that all the time.
We talked to a patient this morning about that.
Yeah.
Because she wants to leave 3 days after surgery. And I told her, I was like, that's kind of,
Pushing it.
that's hard. Can you give me an extra day on that? It's almost like a negotiation.
Right. Well, and for us, a lot of the factors that lead into how long we tell a patient they have to stay after surgery is what kind of surgery they're having done. Some patients they're fine to travel the next day. They can go back home the very next day. We'll see them for a quick follow-up. They're fine to go. That depends a lot on what their follow-up plan is, and I'll talk more about that in my list, and where they're going. I mean, we're going to feel a lot differently about a patient traveling within our country or our state versus someone traveling thousands of miles away from us.
And we've had that.
Yes.
I don't remember what it was like. I don't know. I always go back to Bali, but it was something like that. They wanted to travel to Bali.
Oh, we have a patient who lived in Bali.
Well, she lived in Bali.
Yeah.
Maybe it wasn't Bali. It was someplace like that. Some place that you couldn't even find on a map if you tried. And she's like, yeah, I'm going to get on a plane like 4 days later. I'm like, no, you're not. Like, do they even have a formalized healthcare system wherever you're going? There's like, no, you're not. You're not going. So I think that it does depend on where you live and how far away you are. Like for our patients that are in state, a couple of hours away, yeah, it's totally fine. They could get back to us if they had to,
Yeah, so that's a really important question to ask your surgeon, how long you have to stay after surgery.
Right.
Next question to follow up with that is, will you need to return for in-person follow-up? Like, when do they need to see you again? Can your follow-ups be done via video, or do you have to come physically back? And again, that plays into how long a person has to stay with us. If somebody is traveling out of the country and we'll never see them again, I'm going to insist that you stay longer just to make sure that everything is fine.
Because you may end up like that lady in Costa Rica. I don't know what happened to her. Yeah.
Yeah.
Don't know.
Nobody knows.
Yeah.
And do they even have the ability to follow up virtually? That's a good question to ask as well. Will your sutures and drains be removed before you leave? Good question. Because if they're not, what is your plan for medical care at home if needed?
I like how you're putting your hand down.
Right.
Like this. There you go. There you go.
What is your plan for medical care at home if needed? Because this is a really big deal. If you are planning on leaving your surgeon and you have a drain in, a surgical drain, who's going to take that drain out?
Right.
And I have had a patient call and ask if we would take their postoperative drains out for them. And it was a unique situation. And my answer was no, I'm sorry, you need to go back to your operating surgeon for that. If you plan on needing medical care once you return home,
You should talk to them beforehand.
absolutely need to plan for that before you leave.
Yeah, you should talk to the office and say, I'm going to do this.
Or meet with the doctor, see if they are willing to
Or
handle your care.
to see if there's a charge. Pull out a drain $100 or whatever. Just get it scheduled beforehand.
Yeah, that's really important because it as much as, and this is specific to elective surgery, you probably would find it a lot different with orthopedic surgery or something else that's medically necessary. If you're doing elective surgery and you don't choose to do it with the surgeon who is near you,
They have no responsibility for you.
Nope.
Yeah.
They're going to send you
We
to
may
the
be
ER.
the only office that helps people out. I shouldn't say that on this podcast. We're going to get all these people
No, but it's
from
rare
Costa
to
Rican
find.
surgeries.
Yeah. And even us, that we won't accept, we're the same way. Like I said, depending on the situation, there are times when I'm sorry, like you need to go either see an infectious disease person about this or someone else. Like, this is not our problem.
Right.
You don't need revision surgery. You're not looking for anything cosmetic. You just want medical care. Like, you got to follow up with your PCP, somebody else.
Yeah.
So you need to know that ahead of time, like what type of follow-up care you might need, who would be the one to do that. And we have patients who it's fine with us. They have maybe 2 sutures in place. I show their significant other how to take them out. We do it live on video a week later. It's totally fine.
And that's one thing. If you're going to travel somewhere, it'd be nice for you to go to a practice like ours that does a lot of telehealth. We do an immense amount of telehealth. And we can do a majority of the stuff on telehealth we need to do. So, obviously there's certain surgeries that you need to stick around a little bit so we can take some sutures out. But other than that, most of the surgeries you can get out of here pretty quickly, and we can do all the follow-ups on telehealth.
Yeah. Yeah, so there's a lot to think about before you go. There's a lot to think about, I think, in general if you're going to be traveling for surgery. But ultimately, it can be great. We, like Dr. Brent said at the beginning, a lot of our patients travel. Some
Right.
travel from just several hours away, some travel from a state or two away, and some travel from other countries. And, we try and make it a great experience, but we're also really used to that. So,
Yeah, I have to say, even during this past year, which we went through some stuff, in this country, people still traveled and they still came here.
yeah.
So we just did our testing beforehand, and they were good to go. I think it's a great option. It makes me think we should start like a satellite practice in some resort area.
Well, we've done that.
Well, I mean, Aspen, I guess, is a resort, isn't
Yes,
it?
we have done that.
I know we need like a beach.
Well, that's what I've said. I have said this repeatedly. Like, we are never, the next office we open is going to have sand and beach because
Nils, what's your call? Where do you want to go? Where's the beach area you want to go? I'm
warm beach.
saying St. Bart's.
Not going to Southern California or to Northern California.
What?
Warm beach.
You want to stay in the U.S.?
No, I don't want to stay in the U.S. I just mean warm beach.
Okay.
Yeah, I don't want
St. Bart's
cold
is warm.
beach. Yeah.
Nils?
Man, I don't like warm. I'm a Viking.
Oh, my God.
He's like Vancouver Island, yeah.
Ice-
Canada.
Banff. Oh, Banff
Iceland.
is beautiful. Yeah.
Greenland?
Greenland. Yeah.
Some remote outpost. We're doing surgery up there?
They need it.
Yeah.
People need surgery.
Well, okay, we'll work on that. So hopefully this time next year we'll have our resort surgery stuff, and I think it'd be great. So we could just do it like 3 times a year. Take the family down there. Do surgery in the morning, beach in the afternoon. This is sounding pretty good.
See, I told you this is a great idea.
This is so
Yes,
awesome.
the beach is a good idea.
Maybe podcast a little bit. Do some YouTube
On
videos.
location,
Yeah. Have
yes.
some nice dinners.
Sounds like a great idea.
All right.
Yeah. So
Wow.
thank you all so much for listening to this podcast. Hopefully you listened in 1.5 speed like I do.
Yeah.
So you got the full fast forward
Because you got to be
experience.
really type A, OCD, and efficient like Amy. You can't enjoy the content.
No.
You have to do it really
Faster.
fast.
More podcasts.
So you can successfully listen to everything you wanted to listen
Pack
to.
more knowledge
You-
in there.
You definitely do not have pathology.
No, not at all.
Okay.
So if you did enjoy this podcast, we would very much appreciate if you would leave us a like, a comment, a rating, a review, share us with your friends. It really does help.
The question, are you going to do the thing you do every time, which is
And beg for people to leave me a voicemail?
Which is totally embarrassing.
Yes, I am. Someone left
No one
me-
has called you.
Yes,
are,
they have. I got a voicemail. Yes.
Oh, you did?
I
Was
posted,
it a prank call?
No, it was a real call, and I posted it on Instagram.
Oh, nice.
Yeah. So we have one. So for our
We
next,
should play that. We should just have a whole episode just with that voicemail.
well, hopefully we'll have more because we will play that voicemail in our next questions from viewers. So if you'd like
Good.
to be included, please leave us a voicemail.
So what's the number?
The number is in the notes. It's 303-630-9038.
And maybe just give Amy some compliments because she's putting her number out there all the time.
No one
Nobody's
leaves me.
calling. No one's calling. That's hard.
One caller.
One caller.
Hold on to that one.
Yeah.
So
As I would tell my daughter, you at least got one.
that's right. You,
Yeah.
you got one.
You got one.
So thank you again so much, everyone, for listening. We do really appreciate it, and we hope you will join us again next time.
See ya.
Don't forget to check out our sponsor, Let's Get Checked. Let's Get Checked offers fast, affordable, and completely confidential health testing for everything from STDs, male and female hormones, and even COVID-19, right from the comfort of your own home. And remember, new customers and listeners of our podcast get 20% off by using our URL, trylgc.com/beauty, and be sure to use the code BEAUTY20 at checkout. That's trylgc.com/beauty and use the code BEAUTY20, beauty, BEATUY 20 at checkout. Get checked. It's the right thing to do.